When looking at a female vest, imagine that it would be a normal vest just covering the chest as with a man or a child, but we need to accommodate the breasts. So what we do is most of the measurements are the same apart from the ones that specify exactly where the breast cup needs to be located. And imagine you take the vest and you cut the garment just across the crest of the breast, and then you produce a cup that fills the gap that would occur if you cut that seam, and then you have to fill that gap, and those will be the measurements that we take to define the breast cup. Particularly for the breast measurements, which is identified by the dotted line on the measurement sheet and then has a specific box for female breast extra measurements beyond what you'd normally do for the man or the child. This mannequin's been drawn up with all the measurements actually on her so that you can see that what we're trying to achieve is seeing exactly where that breast needs to break through the garment and then be contained and accommodated by a cup. So having defined exactly where the neckline and the axilla are, we then need to look for where the breast actually breaks away. That's where the flesh starts protruding away from the rib cage, and that would be a significant point. So you may have measured from the collarbone to the axilla line, and then that one would generally be where you'd measured across the nipples, but it's hard to say across the nipples because some breasts, because the patient is naked, will have sagged or distended with size, weight or age. But it's this particular mark here that is significant as the breast breaks away. And then to get the next measurement, which is under the breast, you actually need to ask the patient to cup their breasts and actually lift them with both their hands so that you can find the place where the skin comes away from the chest, and that's where you make your next measurement, right under the breast, and then you need to make that mark, and that's the mark that once again you measure between that one and that one. Those two are vital because they will define just where that cup is going to be inserted. And then you need to have this measurement, which goes again from that edge of the neckline on the top of the shoulder to the breast. Now, the breast cupped, not the breast left down. The breast cupped, but not uncomfortably cupped, not brought right up unnaturally, just cupped so that you could see the crest of the breast. It may be a nipple, it may not actually be a nipple, but the fullness of the breast, and that's that measurement there. And you could do it on both sides because they may not be the same. So those measurements are important, and then the next measurement would be while the patient is cupping. It's a little bit awkward, but try and see the fullness of the breast, because some breasts will be very full and others will be quite simple to measure, and that's called the rise from the rib up and around the fullness of the breast to that area that you identified as the crest of the breast. And then of course you'd want to get the distance between those areas. So having the patient still cupping the breast, you'd get an idea of what the distance is. And the reason, as seen on the vest, is that is where on a normal flat vest with all the other measurements having calculated the vest size and shape, you then have to cut away and insert the cup. And that is what's going to be needed to get the breast in the correct place. It is very awkward to have a vest and you'll find that the cups are down here or up there. You need to be sure and very aware of the fact that they're always a good distance down from the armpit. They can't be very high up and they can't be very low down. They do occur apparently between the third and fifth rib.